control in this room. Um, Good morning. It is 11:01. I did say we get started at 11:01, and it actually gained us about 70 people just waiting that extra minute. So I think it was worth the wait. I want to just first start out by saying thank you to Amy Huntington, who is the community liaison in the Eastern Service Area, and Linda Detman, who is a program manager under our policy division that does case management, for putting together this presentation, along with Claire Wisniewski, who she's always behind the scenes doing all the things for us to make these things happen. She's putting together these PowerPoints. She is getting it ready to go. She is running the slides. So I just want to give her a quick shout out for all the things that she is doing to make this happen every month. So thank you for that. Amy and Linda, I want to thank you for being willing to take the lead on this. We have some new things coming, and we want to make sure that you all are prepared for some of the changes that are coming our way. What I want to just remind you is oftentimes we have people throwing in questions in the chat. It is nearly impossible when you have almost 400 people on a Zoom meeting to keep up with the chat. So if you have a question to ask, please, let's get through the presentation, raise your hand and ask the questions with your camera on. That would be most helpful, and be sure as a way to get those questions answered. So without delaying any further, I am going to hand it off to Amy. I think she's going to start off between the two of them, and we will hear all things drug testing today.
All right. Thank you, Lori, and thank you, Claire, for assisting us today. As Lori mentioned, I am the Eastern Service Area Community Liaison. I am also the Eastern Service Area Drug Test Coordinator. I am actually going to hand it off to Linda, who will start our presentation today.
Good morning, everyone. My name is Linda Detman, and as Lori mentioned, I'm a program manager in the Policy Bureau, and I'm also the contract manager for the drug testing contract. We're here today to talk to you a little bit about some of the changes to the drug testing contract, as well as some changes that are up and coming under the protocol and policy manual around drug testing. So effective July 1st, we will have a new drug testing contract in place. CIJDC will continue to complete the collections for drug testing, and there will continue to be 3 modes of collection, which our primary mode of collection is our various fixed sites across the state, as well as we also have in-home testing and emergency collection. Both of those types of testing do require SAM and/or SWA approval prior to authorizing. And with the in-home testing, that is completed within 72 hours of the authorization, whereas with the emergency testing, that's completed within 24 hours of authorization. And those are limited to situations where there's not availability for the client to be able to go to a various fixed site, or they're more in a rural area where it's not feasible for them to make it to a fixed site. There's transportation issues or other issues that may be interceding with them not being able to get to a fixed site. I do want to point out that all samples are shipped within 2 business days of collection, and they will be shipped via FedEx overnight shipping to the lab. Now, this is a change. Currently, the sweat patch has not been shipped via FedEx, and we've had various issues with the sample being lost or being delayed and us receiving the results. So this will help with all test types being shipped via FedEx. This will help and allow us the ability to track all samples that are sent. Under the new contract, we will be offering a new test type called the oral swab, and we will also be adding a new service, the medical review officer service, which I will talk to you more about in a few slides down. As far as the oral swab, I do want to mention that while it will be in the contract effective July 1, it's not yet available in the system. So we are awaiting Jarvis enhancements in order to be able to access that test type, and we will let all staff know once that is available. So the test types that we do offer under the contract are the instant urine, the urine 9 panel, the urine 9 panel plus alcohol, the urine 14 panel, the oral swab, the sweat patch, and the hair test. You'll see in this chart here, it lists all the different substances that can be detected by each of the different test types. I want to point out that the UA14 and the oral swab both have the ability to test for fentanyl. I know there's some staff that weren't aware that we had that availability to test for fentanyl. So those two types of tests, we do offer that drug to be detected. And there is one, I did notice after reviewing these slides this morning again, that there was one mistake here. If you look at the UA14, it says that PCP is not tested in that panel, but it is. It actually is. So that should be checked in that box there, and we'll have to get that updated in our policy manual as well. Okay, the medical review officer. Now this is brand new. This is going to be a change that's up and coming. The medical review officer is a licensed physician that's contracted through the lab, and they'll have appropriate medical training and certification in toxicology and substance use testing review. They'll be reviewing and verifying all positive, adulterated, substituted, and invalid test results. They'll be conducting confidential interviews with the client in order to determine whether an alternative medical explanation, such as a valid prescription, exists for any non-negative test result. The MRO really is what they are. They provide a quality assurance review. They're an independent and impartial advocate for the accuracy and integrity of the drug testing process. And this will be in place by August 1st. And if it's prior to then, we will also be notifying you of that, but there's still some pieces that we're trying to flesh out prior to the MRO being in our workflow process. But we wanted you to be aware that this is up and coming because it will cause a few days delay in us receiving those results. You may notice that, and we will have the exact time frame for you when this process is in place, but it will delay the results because with them reaching out to the client, verifying any prescriptions, they will be reaching out to the pharmacy as well. They may reach out to the CPW, SWCM, and/or drug testing coordinator to help facilitate that contact. So that would cause some of the few days delay in us receiving the results. And for negative test results, they will not require MRO review. They will just be listed immediately into the platform. Okay, drug testing during child abuse assessments. There will be no changes to this process during the child abuse assessments. We will continue to be allowed to offer one test per client during the assessment. Any type of test may be authorized during this phase. And as far as with a child, at the request of HHS, a health practitioner may perform drug testing on a child before or during a child abuse assessment when the practitioner has determined that it's medically indicated. And drug testing should not be authorized during a family assessment. Okay, drug testing during ongoing case management. This is where you're going to see the most changes to our protocol and policy. There was a small work group that met, and Amy's going to talk a little bit more about that. But we did look at our policy manual, which many of you may know as COM 626, which outlines the procedures for drug testing. We did look at that. We made some changes and updates to that. And our tentative implementation date is September 1. And again, this is pending Jarvis enhancements and the availability of those changes to be made to the system in order to reflect our new protocol. So with the new protocol, the hair, sweat patch, and instant urine will all require supervisor approval prior to authorization. And there will be phases for testing in the new protocol. There'll be an initial phase, stabilization phase, and a return to use phase. Lori, did you want me to answer questions now? I see somebody has their hand raised, but I can wait till the end, or do you?
Whatever works smooth for you, Linda, is fine. I mean, Wednesday has her hand raised if you want to answer her question. Yeah.
Sure.
Hi, sorry. Last week, I know that supervisors here in the Des Moines service area, we kind of discussed why our instant tests were, I think, higher. Do we know, is that something that we're doing on the entry side or is that something that is happening on this central Iowa side? Or is that still being looked into?
No, we did get some answers to that. It appears that that must have been an agreement that was made some time ago, that for any, I think UA9, that an incident is automatically done. But under the new contract and in the new process, that will not be the case. If you would like to see an instant test done, that will be, you'll have to do 2 separate tests on the authorization, one for the instant and one for the UA9.
Okay, nope, that makes sense. I just know that that'll be a change, I guess, not maybe in how we're entering them, but then in what we're receiving with this as well. So thank you.
Right, you're welcome. Okay, and now I'm going to hand it over actually to Amy to talk about the initial phase of testing.
All right. Thank you. So as Linda mentioned, there was a group that convened together in Des Moines to work on the policy and practice manual. In doing so, we reviewed several different evidence-based programming for drug testing and have decided to go with the START model, along with receiving some direction from Dr. Cruz, our state medical director. So these phases are specific to ongoing case management. As Linda mentioned, there's no changes to the child protection assessment process for drug testing. So during the initial phase of a case, so the onset of a case, or if a client is already engaged in substance abuse treatment for intensive outpatient or inpatient options, or have a return to use, or what we previously have referred to as a relapse, or for any reason determined through supervisor consultation. During the initial phase, workers will have an opportunity to authorize up to 1 drug test per week for up to 60 days. The form of drug testing during this phase will be urine or oral swab once the oral swab is available. Something to note about this phase is that selecting random drug testing in Jarvis will probably make it easier for workers because utilizing the random drug testing, clients will be asked to either call the 800 number or get on the website to determine when they will be reporting to the fixed site for collection. We will still have the option to do 1 test and stop during this phase. However, it will be on the worker then to notify the client when they need to report. And that will, of course, require more of your time versus the client either calling the 800 number or checking the website. After these 60 days and with supervisor consultation, a client can move to what will now be called the stabilization phase of drug testing. During this phase, drug testing will be less frequent and can be every other week or twice a month, as long as a client is doing well in their substance abuse treatment or have successfully completed it, are consistent with having substances not detected on drug screens, and have no behavioral indicators that would warrant the need for more frequent drug testing. During this phase, we will continue to use the urine and oral swab as methods of collection. And as Linda had mentioned, you will have the option to do sweat or hair. However, those circumstances should be very limited and again will require supervisor approval. If at any point during the life of a case, a client were to return to the use of a substance or have what we previously called a relapse, you will have the ability to go back to the initial phase of drug testing, which will allow weekly random testing by urine or oral swab. Of course, Throughout the life of the case, we are encouraging all workers to be collaborating regularly with the substance abuse providers and potentially utilizing the drug test results that the substance abuse provider is having the client participate in. By collaborating with substance abuse providers, this of course limits the amount of drug testing that we would maybe need a family to test, along with enhancing supports and modifying any interventions that would be needed if there was a return to use. So something for us to consider, particularly with the use of sweat patches and hair stat drug testing, is the location that a family has to travel to get to a fixed site. Also, the availability of drug testing at those fixed sites with regards to the client's availability. We would want to take into consideration when collaborating with substance abuse providers that the test that they're utilizing is lab-based and verified. And again, as a reminder, sweat patches and hair stats will only be by supervisor approval and should be the last resort of drug testing utilized. Something else to take into consideration is when deciding to drug test during particularly the stabilization phase is whether or not there's any behavioral indicators that a client is sorry, muted myself.
Yep.
So when during the initial phase and ongoing life of the case, something to take into consideration when deciding on drug testing is whether or not the client is displaying any behaviors that would warrant the need for drug testing. So we have listed some of these behaviors here, but of course there's always plenty of other ones. Every person is different in how they behave and interact when under an illegal substance or a substance. One of the other things that will be probably new to most of us is that during drug testing, we will also be utilizing some screening tools with supervisor consultation. Sorry, I forgot to mention, we've also listed some other indicators that may warrant the need for drug testing, such as physical appearance or the client's physical environment. For example, if a client's home is typically well organized and cleanly, and you start to notice things are disorganized or cluttered, or you're seeing signs of drug paraphernalia, those would all warrant the reasons for possibly needing a client to drug test. So as I previously mentioned, we will also be utilizing screening tools to assist us in determining when drug testing would be appropriate. These tools will be available and should be utilized both during a child abuse assessment and throughout the life of a case. With regards to adults, you will be utilizing the UNCOPE or CAGE questions. And with respects to adolescents, you will be using the screening tool called CRAFT. All three of these screening tools will be provided some training on at a later time through most likely a webinar, but that is to come. The last thing I wanted to just remind everybody about is when you're authorizing drug testing, particularly on the case management side, is that you're utilizing the correct funding source. So this screen here is a screenshot of what Jarvis looks like. When you're selecting your funding source, particularly for court-involved families, if the court has not specifically scripted out who is going to be drug tested, when they're going to be drug tested, and the method of drug testing, you will want to utilize the funding source Family Child Welfare with no court order and no docket number noted. If the court orders drug testing at HHS's discretion, again, this you will want to utilize child welfare, no court, and no court docket. If the court has scripted out very specifically who's drug testing, when they'll be drug testing, and how they will be drug tested, then you would select court ordered, that the court ordered mandates prescriptive drug testing, and you will enter in a court docket number. This will assist us in being good stewards of our court-ordered service funding. So with that, as Linda mentioned, some of these changes will not occur right away come July 1, because we do have to do some enhancements with Jarvis. We also have to continue developing the contractual language needed for the medical review officer. But we will make sure that information about these changes and when they will take effect will get out to all of you, either through a help desk tidbit or the webinars that will be provided to you with regards to the screening tools.